Good morning. Welcome back to 41 Action News Today. This morning we have Dr. Mary Ann Jackson, a pediatric infectious diseases doctor at Children's Mercy, in addition to working at the UMKC School of Medicine.
We appreciate you taking time out to be with us this morning. The main reason we're having you here and with everything we're doing is trying to allay some fears and educate people about what's going on. What is most concerning to you about coronavirus as we move forward and now have cases in our area?
Well, I think what's most concerning is we know that this is going to evolve over time. If we look back to 2009 when we had H1N1 circulating, in the end, we had 60 million cases in the United States, and that was with having a vaccine and having an antiviral. So I think this is going to ramp up across the United States, and in locales where they're not seeing disease right now, people are staying calm. But as soon as that disease comes into those communities and ramps up and produces disruptions, that's when people are getting nervous.
And we've heard from a lot of concerned families with kids. Why is this seeming to not affect kids the same way as elderly or people with underlying conditions? Do we know?
We don't know precisely, but children have a ramped up immune system. They're exposed to a lot of different things. Their immune system is prepared for something like this, and there likely is disease in the pediatric population. It is likely mild disease. And with any virus, they may be the vector for transmission of disease without being very ill. I suspect there may be some cases that are more serious in children who have some type of underlying medical condition. Those are things that we don't know yet.
We're in a time of year where people obviously still going to school, but also getting ready for spring break, that kind of thing, a lot of travel for families. What are you telling families right now, assuming that everybody in the family is healthy? Is it case by case depending on where they're going to go, what they need to be doing? What are you telling families right now?
I think right now, in families that have no one with an underlying medical condition, and assuming that an elderly grandparent isn't going on the trip, it's okay to travel. I think that is going to be the case right now until we see disease that's across the United States. And so people who are going to Disney for spring break, that's fine right now.
When do you see that potentially changing? We heard yesterday some people think that's just 2 to 4 weeks away.
I think that may be correct. So when I think about coronavirus, I think of be knowledgeable, be prepared, stay calm, and be kind. And the be knowledgeable is keeping up on the information as you all are sharing right now. The be prepared is knowing that this is going to ramp up, and it's probably going to be very fluid over the next 3 to 4 to 5 weeks. And as we see disease increase, then I think we're going to have to be prepared for disruptions, for business, for schools, for life. And that's the part where being prepared is important, and understanding that if you're healthy and don't have symptoms, we're not going to flock to the healthcare.
To that point on symptoms, because obviously this is still flu season, a little bit of allergy season. If people notice specific symptoms, what should people be aware of if they're thinking about this?
So people should think about this virus the same way they're thinking of every other illness that they get within the family. So for simple colds, you don't need to seek a doctor's care. So the healthy, worried, don't flock to the ER. For those who are developing symptoms, use the same rules of thumb for fever. Fever control, hydration. If you have an underlying medical condition, checking in with your doctor. And then the same issues with any other virus, which would be if you develop very high fever and or shortness of breath or profound fatigue. Those are going to be cases where you're going to call ahead first if we do have coronavirus in our area before you go into a healthcare system, so they can be prepared. And most are prepared. It's just that as the disease ramps up, I think the testing needs to be ramped up too, and we're not quite there yet. And I think that as you get there, you're going to see healthcare organizations, even the very well-prepared ones, are not going to be quite able to handle the number of patients they're seeing. We saw this with H1N1, so we know what the lessons are, and we came through that. We'll come through this one too.
We could talk to her for hours about this. There's so many questions.
Everyone is curious about what's going on, but we appreciate your time this morning.
Thank you. Thanks so much. All right, if you have any questions, you can still ask those. Remember, we have this form. This is right on kshb.com. You can submit your questions. We will look for those answers with people like Dr. Jackson here.
kshb.com/coronavirus. We're updating that all the time with new information, research, so you can learn the latest. Really important tool for you to use for you and your family.